Nigeria, and when did you came?
Like maybe 97. So I've been here for a while.
Okay, good, good.
All right. So nice chatting with you. Good morning, everyone. We're live. This is the voice and the face of Dr. Olabintan, CEO and co-founder of Livingspring Family Medical Center here in the awesome city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. And I'm very excited today to be having a talk. And the topic is, Doc, my friends have hit puberty and I'm still waiting. Should I be concerned? And I'm so excited. I had a lot of conversations briefly with our guest, Dr. Sheila Pérez-Colón. Now, you tell me if I didn't do a good job, but thank you so much for being here and welcome.
Thank you so much, doctor, for having me. Definitely, you did a good job.
Thank you. All right. For those who are wondering, who are watching, like, wow, who's this beautiful woman? I would love to kind of know who she is. So, Doc, please introduce yourself to our viewers. Who are you and what do you do?
Sure. My name is Dr. Sheila Pérez-Colón. I am a board-certified pediatric endocrinologist. I am currently practicing. I have my own private practice in Puerto Rico. The name is Elite Endocrine MD. Actually, I am the first direct care specialty clinic, in the island. So I'm very proud to have brought here the model of direct specialty care. A little bit about myself. I grew here. I left for 22 years. I did my training in the US. I work in New York, in LA, and Miami, but I came back just over 6 months ago to the island to improve the medical care here in Puerto Rico, and hopefully I can contribute to the medical system here.
Awesome, awesome. And for emphasis, I mean, I just found that out, just shortly before we went live, that you were here for 22 years and you decided, you know what, I need to go back and give back to my community and improve it the best way I can. Big hats off to you on that. I'm really proud of you, Doc.
Thank you so much. Thank you.
All right. Now, inquiring minds want to know, Doc, why do you do what you do? What's the story behind, like, why do you do what you do?
Well, I did pediatric endocrinologist because, of course, I love kids and I like to be around kids. However, the other side is like they can most of the time express how they are feeling. If they are sick, they can do it in a way that we adults do. So
Mhm.
I am happy to be able to try to that out, not only with the children and adolescent. Within pediatric, we work along with the family members. So that's something
Mm.
that I always like. I have adults plus children's, right? And endocrinology specifically, because I do love the endocrine system. Actually, I was fascinated in medical school when I encountered the hormone, right? And all the pathway, how does it work? It's a very complex system, but it plays a vital role in our organ, right? And in our health. It
Right.
works and it impacts the metabolic system. It impacts the growth of the children, even the puberty. So that's why I am doing a pediatric endocrinologist. I am pediatric endocrinologist. And actually, I love it every single day. Every day that I wake up, I am so happy and so eager to see my patient because this is what I love to do.
I can tell you're very passionate, and in watching some of your video, your content, you could tell it oozes out of you. You're very passionate about what you do, and I love how you said you like seeing children, but you also get to interact with the family because obviously you pull all of them together. So it's a win-win. It's a win-win
Exactly.
situation. All
Yeah.
right. So today's topic, we're talking puberty. So for someone who's watching, maybe a preteen or a teenager who's watching, who's like, okay, what is puberty? And then for a boy and for a girl, like what is puberty?
Well, puberty is the stage in which there's some maturations in every sense, reproductive maturation, there's physical changes, there's emotional changes, there are cognitive changes. So in an easy word, it's like when we change from, being a child into going into adulthood, right? And for those, the hormones, which are some chemicals in our bodies, are the ones responsible for those changes. Puberty start different in boys and girls, right? And even within the boys or all girls, it start at different time, and it's normal. We need to understand that puberty is completely a normal process, right? At what age does it start? Well, in girls, it's normal if it starts after the age of 8 years of age, and in boys after 9 years of age. If it starts before those, then we call it early puberty, or
Mm.
another term is called precocious puberty. It started a little ahead. And if
Okay.
it's delay or is too late, right, then we say it is after 13 years of age in girls and 14 years of age in boys. And that's like they started a little later than they are supposed to, right? What do we see in puberty? Maybe that may be a question. How do I
Yeah,
know I'm
yes.
in puberty?
Yeah, how do you know?
Yeah, so we will know the first sign of puberty in girls is like breast development, what we call breast budding. That's the first sign of puberty. In boys, actually, is testicular enlargement, right? It's not necessarily noting like we need some deodorant, for example, that we have some axillary hair or some facial hair. The first sign of puberty is testicular enlargement. And we do that in the clinic, right, by physical examination. We have some classification called the Tanner staging. So the doctor, every time they come to me to the clinic or they even go to the general pediatrician, right, we take a look at the exam, the full exam, and we grade it. And we say, for example, number one, this patient, this child or adolescent is not in puberty yet. And then number two, yes, they started puberty. So if you go to your doctor and they say you're in puberty, they most likely you have an exam that is 2 or above.
Okay, 2 or above. And you said in boys it starts at 9 of years of age, and in girls it starts at 8. So girls mature faster than boys. Wee.
Definitely. And that's something important to know because many of the adolescents and children come to the clinic and even the parents concerned about, they say, I'm the smallest of my class or of the soccer team, right? And we're the same age. What's going on with me? So it's important for us. And I always educate them like we all enter puberty at different ranges and ages, even though for boys, for example, the normal is starting at 9 and after. It may be normal a child that is 10 years old, a boy, and is not in puberty yet, or 11 years old and is not in puberty yet. So we have some years in which we are within normal, right, to enter puberty. But we are different. There's many factors that involve in that starting of the puberty and either progressive of puberty. So it's not a specific day that you should be hitting puberty.
Yes, and that's the key word here. Everyone is different. Your staging is different from that of your classmates, even though you're in the same age. I remember growing up, my parents didn't want me to, they were not too eager about puberty, me reaching puberty early. But my classmates, I had friends who would stuff their bras, and everyone looked mature, and I'm like, whoa, what's going on? What's going on with me? And then when it happened, it happens. But it can be a very trying and challenging time. So if you're watching, if you know a teenager, a preteen who's like, I don't know what's going on, my mates are doing this or doing that, and I'm not quite, don't be alarmed if you fall within the range of normal. Don't be alarmed. It could be a little later, it could be a little earlier. You're unique. Okay. Now, Doc, I was going to ask you, someone who's watching, who's saying, okay, so how soon should I, if I'm concerned, let's say as a boy, you said by 14, I'm 13 years of age or 13 and a half. Do you advise that we wait till we're 14? Or for the girl, oh, I'm 12 and a half and nothing, no breast development, no hit, nothing. I'm not in stage 1, 2. Should I wait till I'm 13? Or like, what would you say to that teenager or the parent who's here watching? Like, should we wait till that age cutoff to go talk to a doctor? When would you advise, Doc?
I would say nothing in life is 100%, right? So if there is a family that has the concern, number one, we should be following frequently with our pediatrician, right? The general pediatrician is the main doctor. So every time you go to the doctor, maybe when you're 11, when you're 12, we're already monitoring. So it's not like we just wait until the end to see if you're going there or not. But for us to do a referral, for example, to see me, the endocrinologist, or to do some workup, some imaging, some blood work, yeah, we do wait until those ages for us to be considered like out of the norm.
Okay, I got you. And so it's very important going for your checkups, your pediatric checkups every year. So things are monitored and questions like these can be addressed. But if you're in the tail end as far as age, you see your doctor, and you can get there. If you're in Puerto Rico area, you can come see doc as needed.
I wanted to say something else. There's some gray area for girls, for example, the age of 12 or 13, but most of us go by the age of 13 and girls. Okay. And you mentioned, for example, like girls developing a little earlier. Yes, girls do enter puberty earlier, maybe with a year and a half earlier than boys. That's why you will start seeing the changes early. However, the growth spurt, right? Because during puberty, I mentioned there's a lot of changes. One of them is like physical changes, and you'll see the sign that I mentioned, but we also get taller, right? We get what we call the growth spurt, the maximum growth. And usually that growth spurt happens earlier in girls. So when they're in high school, boys are like, oh, girls are much taller, why we're shorter? But in 2-3 years, you see that the boys actually catch up and even go taller because the growth spurt is even higher. So
Right.
boys enter puberty later, but they tend to catch up and be even above girls in terms of height, for example.
Yeah, I remember feeling tall briefly.
Yes.
It was brief, Doc. All right, someone who's watching is like, Doc, I have this question I wanted to ask. Is there any way to speed it up? Because everybody is doing stuff. I'm the only one, absolute only one in my class that hasn't hit it yet. And I don't like, and someone's asking, is there a way to speed it up? Or you have another person who's like, yeah, I seem to have started early, Doc, and is calling attention to myself, and I don't like. Is there a way to speed it up or slow it down, or do you advise?
So that will be a very good question. It is the question very common in clinic. So in terms of speeding it up, yes, with the endocrine system is amazing, and that's why I went into it, because we can help like bring things like hormones higher if we need to, or if they're increased, we can bring it down to normal. So the answer is yes, there's some medication that we could use, but we wait for that, right? So at first we try to educate the child about what I spoke, like we're all different, don't worry, we're monitoring you. Most likely, if that's the case, you will reach the final height that you're supposed to, so just be patient, you're going to be there. But if we are already close to the ages, right, or at the ages and there's no puberty at all, we can give a short like term therapy. For example, for boys, we could give testosterone. Testosterone is a kind of the male hormone. Be careful, we girls produce testosterone, but in much less amount. For boys, we give testosterone, and that could help speeding up puberty, or in a boy that there's no puberty, it can help to start the puberty, actually. So we give a short-term course of testosterone if there's no condition at all. It's just like it's very concerns, there's psychologically that patient is really affected, we could try that. On patients who have the diagnosis, like we did the workup and we did find out that the patient has a condition, a medical condition, in which there's deficiency of this hormone or the messengers of these hormones coming from the brain, we give a longer treatment. So for boys, we could give testosterone if indicated. And in the other hand, for girls, we could also give some estrogen, right? Which is the hormone that is responsible to start puberty and to keep puberty in girls. Again, we give it on cases that are absolutely necessary. We do all the workup before doing that. That is kind of to start the puberty, right? In the other way, right, to slow down the puberty, yes, we also do have medication for that. So for whoever patient has precocious puberty, for example, it's a 6-year-old boy already in puberty, it's a 5-year-old already in puberty, then we do the workup, we try to find out why is this patient in puberty, and we could offer treatment. Treatment for that case of early puberty also is given a hormone, right? It's an injection, and it comes in patches, and it's a way to kind of slow down the puberty. So yes, we could bring you from early puberty to try to kind of catch up and enter normally. And if you are on delayed puberty, we could, in those cases that are really indicated, we could help you jumpstart that puberty.
Okay. Thank you very much. A lot of information. And of course, these are medical suggestions. Please schedule time with your own doctor to have a conversation in line with this. Now, I have another question for you, Doc. So I have maybe a parent who's watching or a teenager who's watching who didn't like going to see the doctors, who evaded, and COVID happened. So a lot of checkups have been missed. What would you say are maybe 3 to 4 things or times to be concerned when it comes to puberty for a boy or for a girl? Like when should one say, you know what? I really should go see my doctor. What would you say?
I would say definitely, for example, a 15-year-old girl who doesn't have the period or the menarche, menstruation, right? So the first period and hasn't had it at all. Yes, that is come into delayed puberty. We should get checked for that. Right. And also any boys that is a 15, 16 years old that he hasn't going through puberty, he hasn't noticed any changes physically, then come to the doctor. We should check you to see if you're indeed are late. or even early. If there's for example, if you have a child at home who is 5 years old and is already a girl having some breast budding, some breast development that you notice, there's some changes that shouldn't be there, come and see your doctor, or some pubic hair or axillary hair. And it's important for me to clarify, right? There's something called like true puberty, right? Which are the changes that I mentioned before, breast development in girls and testicular enlargement in boys. And there another term called adrenarche, which is just a hormone production from the adrenal gland, which are the glands above the kidneys. Those are the ones that also produce hormone, but those are the ones responsible for your pubic hair, your axillary hair, your adult type body odor. So not necessarily if a 5 or 6 year old is having axillary hair, for example, means that it's in completely puberty, right? Although we always think it together because actually they go in stages. One is different from the other. But if you see any of those signs that I mentioned before, we need to get checked. Take them to the doctor. We'll do a physical exam. We will see if we need any further evaluation and if he or she needs to be seen by an endocrinologist, the hormone specialist.
Awesome. A lot of information you delivered, Doc. I really appreciate you. And I have people who are watching who will watch #live or #replay, and they're saying, where can I connect with this doc? Either to have her come speak to my group of teenagers or speak to their parents, or where can people connect with you, Doc?
Well, we're now in social media, right? We're trying to educate patients as well. So I'm in Instagram. My professional Instagram is Elite Endocrine MD _ Dr. Perez. I'm sure likely we can add it later on. So very soon watching. I also have a website that you can take a look with information. It's www.eliteendocrinemd.com. You can reach me. I will definitely get back to you.
Yes, she's very active on social media. And Doc, we're going to have all of that posted right here so people can connect with you directly, either as a patient or to have you come speak at their event or on their platform. I appreciate you taking the time to come. I know it's an early morning for you as well. Thank you for coming to share your wisdom with our viewers.
Thank you so much for having me. Thank you for everyone who's watching, either now, live, or in replay. Hopefully, we'll talk soon.
Yes, ma'am. Yes, ma'am. Thank you all for watching. As always, please share this with those who could find this useful because sharing is caring. And if you or anyone you know is looking for a passionate and a thorough and a caring family physician who will help you live long and well, I am she. Have a good one. Thank you so much, Doc.
Bye-bye. Have a good day. Thank you.
You too.